Hi, today I'd like to share a short case with you, and this is about shortness of breath with wheezing. So, when you hear about this combination, you may already think about some diagnosis in your mind, such as asthma, COPD, or pneumonia, or others disease. But the case I would like to share today is something different. So we start with the case here. We have a 66-year-old male present to our clinic with a persistent cough since he got a cold a month ago. And he claimed that he only has shortness of breath during exercise, and he thinks it's because of his gaining weight. And there's no fatiguability. And on physical examination, he appears to be short and overweight, and his breathing is noisy, but the chest oscillation is clear, and the neurological examination is normal. And after we order some check, we find the fluid blood count and electrolytes are normal, and the ESL is 6, so we can cross out asthma already. Like, not completely, but you can cross out in your mind at this stage. And we find the static and dynamic pneumonias are normal. Then we have FEV1 for 2.8 liters, and the peak expiratory flow rate is 200. And what is the diagnosis? Before I tell you the answer, let me point out what are the key findings in this case. So, shortness of breath, we point to, so when we saw this, we point to something pulmonary disease, and this is during exercise. And he thinks it's because of his gaining weight. It might not like it is not important at this point, but let's circle it first. And he's overweight, and what is the most important finding in this case is his breathing is noisy, but our chest escalation is clear. What does it mean? It means the problem may not originate from the lung. So uh our our numbers here also prove this are normal. So it might not be something intrinsic of the nun. So when you encounter that breathing is noisy and the chest oscillation is clear, it's very high chance of a upper airway obstruction or something extrinsic. And in this case, this patient is gaining weight and he's overweight, right? So what do you think about this when you hear this combined with the upper airway, that location? What kind of organ you think about? Yes, it is viral gland. So he the diagnosis is he got multinodular goiter. So what is the key I'd like to share today here in this video is this formula. So when you calculate this formula, everything in that formula, this is FEV1 here, but you convert the numbers from liters into milliliters. So the previous slide is 2.8, right? So we times 1,000. So it is 28,000 divided by 200 is 14. So the normal range is 8 to 10. And while this ratio is higher than 10, is likely to be an upper airway obstruction. So combined with the physical examination that we find this noisy in breathing but clear chest oscillation, so it is very clear that there is an upper airway obstruction. So what are you going to do next is reorder chest x-ray, CT chest and neck, and also a full volume loop. So full volume loop is also a very useful tool for you to differentiate those intrinsic, extrinsic, restrictive, obstructive patterns. So there's a lot of things to discuss about, but as long as I think as long as you see the graph is quite easy to understand. And so this is the end of the short case discussion. I hope it helps, and thank you very much.